Once again, thank you for taking time out of your afternoon to join us today. Dr. Kanbour is going to present about cardiovascular disease and learn about how we can prevent hypertension in our daily lives. Dr. Kanbour, the floor is yours. Please start whenever you're ready, sir.
Thank you. Thank you very much. Thank you, everyone, for being here. My name is Majd Kanbour. I'm a cardiologist, part of a Methodist physician group. I practice here at the Heart Center, and I have another office over at the hospital, South Lake. Today, we're going to go over the high blood pressure, hypertension, and talk a little bit about why it happens, what are the treatments, and we're going to spend some time talking about lifestyle changes. I think that's very important at this time to talk about it. We'll go a lot in more details about lifestyle changes toward the end of the presentation. So what is high blood pressure? It's basically it's a condition, a disease where if it puts you at risk of having a heart attack. It's a serious problem if it's not treated. And that's because if it's is not controlled for a long time, it can lead to a heart attack, stroke, kidney problems. And think about it, that if you have high blood pressure, most of the time you don't have any symptoms. That's why they call it the silent killer. So it most of the time it's just found out by, you see your doctor, or you get your blood pressure checked just routinely, and then you find out it's elevated. So no symptoms in general. So when we talk about high blood pressure or hypertension, when we measure the blood pressure, we have two numbers. So if you go to your doctor, always, there's always two numbers there. Let's say your blood pressure is 130/80. So the top number, 130, is the pressure that inside your arteries when the heart is contracting. The bottom number is your blood pressure inside your arteries when the heart is relaxed. So that's why you get two numbers. So each the one means something. Elevated blood pressure is a term that we use as a warning. So people with elevated blood pressure do not have high blood pressure that needs treatment, but they're like their blood pressure is not in the normal range. So it's not high enough that it requires medications, but it's high, it's not normal. That means that we have to take an extra step. And mostly it's lifestyle changes at that time. So how we define it? So in general, we say normal blood pressure is anything below 119 or below 120. So the top number, if it's below 120, that's normal blood pressure. The bottom number, it should be less than 80. So anything less than 120 over 80, that's by definition is normal. Elevated blood pressure is where it's not high, so it doesn't require treatment, but it's not normal. Anything between 120 over 129, and then 79 to or below. The high blood pressure is anything above 130. Now, there is another definition that's the main one that we use to make a decision when to start therapy. So again, normal is less than 120 over 80. Between 120 over 139, that's called pre-hypertension. So again, it's not the range that would require medical therapy, but it's not normal. So it would require lifestyle changes, aggressive lifestyle changes. And then when we get to 140 and above, then that's when we start talking about starting medications in addition to lifestyle changes. The top number anytime goes above 140, and the bottom number has to be more than 90. So that's stage one. More severe blood pressure called stage two. That's when your blood pressure goes over 160 over 100. Why do people get blood pressure? Majority of the time, we don't know. We don't have one reason that we can point toward as, oh, I have high blood pressure because of that thing, and then we just have to correct it and everything's going to be fine. 90% of the time, as we call essential hypertension, or we think it's a lot of things play together that leads to high blood pressure. These could be genetic, lifestyle, behavior, age. No one have control over that, and a lot of other things. Hormonal changes too, chemical changes at the level of the kidney, at the level of the adrenal gland, at the level of the heart. They all play together to raise the blood pressure. But we don't have just one reason, like 90% of the time, we don't know why. Now, minority of the patients, 5 to 10% of the time only, there is a reason. We can point to something, say, your blood pressure is high because your kidney is not functioning well, or because your blood pressure is high because you have a blocked artery in your kidney. That can raise the blood pressure. So if we treat that reason, the blood pressure will go away. If your adrenal gland is producing more cortisone than normal, then it will raise your blood pressure. And once we correct that, that usually leads to normalization of the blood pressure. If your thyroid gland also overproducing thyroid hormones, that also can lead to high blood pressure. But that's only 5 to 10% of the people with high blood pressure. And that's usually there are, so if we see, we check for those reasons when we face something called resistant hypertension. So we treat patients with at least 3 medications. And despite the patient taking the medication, the blood pressure remains high. That's usually an indication that, we should look for secondary reasons for hypertension. So if you have, again, then same thing, you have kidney problems, you have endocrinology problems, hormonal changes that can raise your blood pressure. It is very common to have high blood pressure. Almost 35% of the population in the US, they have high blood pressure. And of those 30%, most of them is in stage 1. Remember, this is stage 1. We say their blood pressure is between 140 above 140 until 160. So most of the people with high blood pressure, their blood numbers fall into this range. Now, can you have, to have high blood pressure, you can have the top number high or the bottom number high. You can have both high or just one of them. So if your top number is high, you still consider high blood pressure or hypertension, even if your bottom number is normal. And the opposite is true. If your systolic or top number is not high and your diastolic or bottom number is high, we still call it hypertension, and that would require treatment. So who would get high blood pressure? Who's at risk? Again, there are things we don't have control over it. Age, just normal process of the wall of the artery gets hardening of the wall of the artery. That just comes with age. Men are more likely to have high blood pressure than women, but until menopause, and at that time, when women exceed menopause age, their risk of having high blood pressure is equal to men. And we think that's because estrogen plays a protective role before menopause. If you have family history of heart problems, yes, you're more likely to have high blood pressure and heart problems. If you don't exercise, if you have sedentary lifestyle, if you are under a lot of stress, social stress, family stress, then you're more likely to have high blood pressure. If you smoke, you eat diet rich with cholesterol and fat, yes, you're more likely to have high blood pressure. Obesity, weight gain, and if you have diabetes, also makes you more likely to develop high blood pressure at some point. Alcohol, high intake of alcohol also raise your blood pressure. So things to keep in mind here. Let's just review again, again, only 5 to 10% that there is a secondary reason, then we don't have to talk much about it. Why do we have to treat the blood pressure? Why do we have to lower it? Simply because if we don't, the patient will be at risk of having all these scary words that you're looking at now. So at the level of the heart, if we don't get your blood pressure under control, so what's going to happen is your heart has to eject blood against a high pressure, and that's with time, in order for the heart to compensate for that, the heart muscle is going to get thicker. And that's not a good thing. When it gets thicker, it compresses the arteries inside the heart. So people can start having chest pains, what we call angina. In severe cases, it can lead to a heart attack. If the high blood pressure remains uncontrolled for a much longer period of time, the heart will lose that ability to compensate. So we end up with the condition called congestive heart failure, where basically the heart muscle is thick, but it's not strong. It's not able to contract very well, and you end up with congestive heart failure. At the level of the brain, the number one risk factor for stroke is high blood pressure. Kidney, a lot of people unfortunately end up with the dialysis just because their blood pressure has been uncontrolled for a very long time. You can get what we call peripheral arterial disease. Basically, what's happening is you can develop blockages in the heart. I'm sorry, blockages in the arteries of your legs. And that, in late stages can lead to what we call limb loss, the gangrene and the risk of losing the leg. Also, it can cause eye problems. How do we make the diagnosis for high blood pressure? As I said earlier, there's most of the time there are no symptoms. So it is just found coincident. You check in your blood pressure just routinely for routine visit, and it's high. Some people may get symptoms, but that usually indicates very high blood pressure. Headache, dizziness, fatigue, and in what we call hypertension crisis, people can have blurry vision and can have nosebleed. But in general, especially at the beginning, there are no symptoms. A lot of times, we advise our patients to check their blood pressure at home. It's self-measurement or home monitoring of the blood pressure. Why is that important? Because it tells me if the treatment we're given to you is working. And in general, it makes people more aware of their condition and make them more likely to adhere to treatment and not miss medications. And also, there's a condition called white coat hypertension. It's basically when you go to see your doctor, every time you go, when we check your blood pressure at the office, it's high. For many reasons, mostly, people get anxious sometimes when they come to see their doctor. When you go back home, or you leave the office, blood pressure goes back to normal. And that's a very important thing that we need to know about, because the only way to find out about it if you check your blood pressure at home. Otherwise, we'll be just throwing medications at you. Just we're assuming that you have high blood pressure. What's the right way? In general, like we want you, before you check your blood pressure, you need to sit quietly for at least 5 minutes in a chair, feet on the floor, and arms supported at the heart level. Use appropriate size cuff and do at least 2 measurements. The frequency, it depends. Like, not everyone will need to check their blood pressure every day or multiple times a day. I think it's something we take individualized approach here. It depends on how controlled or uncontrolled is your blood pressure. Some people would require more frequent check, some people less. Do we have to do any tests? So if you go and see your doctor and they check your blood pressure and say, oh, your blood pressure is high, is there any test that we have to do? Routine tests. Basically, there are the routine tests that we have to do when you're first diagnosed with high blood pressure or hypertension. We do an electrocardiogram. We check your heart because it can tell me, just looking at that ECG, if your heart, for example, if you had high blood pressure for a long time and that led to the thickness of the muscle of your heart, I can tell from looking at the electrocardiogram. So it can be useful to tell us how long you had the blood pressure for. We check urine because we know kidney also play an important role in controlling controlling the blood pressure. So we have to check urine analysis. We check routine blood tests, blood count, electrolytes. We need to know what's your potassium, what's your calcium level in the blood. We like to check cholesterol level. But those are the most common tests that we check. Unless now it depends if we think, remember it's 90% of the people, there's just no reason. We don't know why they get that blood pressure. So those testing are enough. If we, however, think that the patient may have what we call secondary hypertension, then additional tests will be done. But that's, again, the minority of the people. How do we manage the blood pressure? So there are our part, which is making the diagnosis and educating our patient about what is high blood pressure and what they can do on their own to make it better, and also prescribing medications and following up on that. There is also this part of the patient, on the patients themselves, which is they need to know what is high blood pressure. They need to understand it's a serious condition if it's not treated. And also they have to take their medications and do their best to check the blood pressure at home too. So how do we do that? We try to avoid harmful habits like smoking or excessive alcohol intake. Reduce the amount of salt and high-fat diets. We're going to talk more about it in the next few slides. Lose weight if you're overweight or obese. Regular exercise. And what we call DASH diet. And in this slide, you can tell in each lifestyle changes you make, how much impact that has on your blood pressure. So we think if you lose around 10 kilograms of your weight, your blood pressure can drop between 5 to 20 points. If you adapt a good diet, it can drop between 8 to 14 points. If you reduce the amount of sodium or salt in your diet, it drops it between 2 to 8 points. Physical activity, 4 to 9, and moderation of alcohol, 2 to 4. Now, these numbers may not look significant, but those numbers are enough to decrease your chance of having heart attack. They're enough to decrease your chance of having any stroke or any other complication or kidney problems. There are plenty of medications we use for high blood pressure, and they're all good. In general, the most common ones we start with, they call diuretics. So basically, those are the medication that can make you urinate more. So lose fluids, lose salt from your blood. Most common medicines called hydrochlorothiazide or HCTZ. That's their guideline. That's the #1 choice that we usually try. There is another medicine belong to the same group called chlorthalidone. Those are the most common ones. But in general, this is a family of medications that's going to make you urinate more. Beta blockers, there are also common medications we use. Basically, what they do is they relax the muscles in the wall of the arteries, and that leads to decrease in the blood pressure. Calcium channel blockers, they do the same. There is a famous medicine called amlodipine or Norvasc, one of the good medicines, also one of the first-line therapies that we usually start in addition to HCTZ or hydrochlorothiazide. ACE inhibitors, there is a group of medications that's also we usually prefer to use them in diabetic patients with high blood pressure, because we believe they don't only lower your blood pressure, but also they protect your kidneys from the complications of diabetes. So this just slides goes over these medications, possible side effects. So we choose the medicine based on what we call other comorbidities. Again, if you don't have any other conditions, there are certain medicine we use. If you're diabetic, we choose certain medicines. If you have history of congestive heart failure, if you have history of heart disease, then certain medicines would be better for you than others. What is resistant hypertension? That you may hear this term here and there. Is basically it's where we have a patient with high blood pressure. They're on at least 3 medications. One of them is a water pill or the diuretics like HCTZs. The water pill is the other name for them. If they're on 3 medicines, one of them is HCTZ or water pill, and their blood pressure is still not at target, we call it resistant hypertension. And that can be for so many reasons. So this is one of the conditions where we start thinking about this 5 to 10% of the population where there is something else maybe driving the blood pressure up. That's when we start doing more testing, looking at those other conditions. But also, if the patient is, it could be as simple as, patient is not taking their medications. They're not compliant with the diet. They just take a lot of salt. If you use certain medications, such as NSAIDs, these are the pain medications, such as ibuprofen or Aleve, and your blood pressure is not well controlled, then it could be because of that. If you're drinking alcohol excessively, then yes, that also can lead to this resistant hypertension condition. So let's talk about lifestyle changes. What can you do on your own to help with the blood pressure? So I said we do our part. We make the diagnosis, we do the testing, we prescribe medications. Then what are the things that the patient can do themselves to help with the blood pressure? The question is, do they really work? Lifestyle changes, if you do them, do they really lower your blood pressure? The answer is, of course. In fact, they have a big effect on the blood pressure and overall health. So they can lower your blood pressure or sometimes keep you from getting high blood pressure to start with. Reduce the need for blood pressure medications if you follow those lifestyle changes. It can make the medicines you take for blood pressure work better. And of course, they lower your chance of having other conditions such as heart attack, stroke, all these things. So they do work, and they work really well, the lifestyle changes. What are those lifestyle changes? So we talked about them earlier. Number one, if you're overweight and obese, yes, lose weight, that's gonna help. Choose a good diet rich in fruits, vegetables, low-fat dairy products, anything low in meat, sweet, and refined grains. Eat less salt. Do something active for at least 30 minutes a day on most days of the week. And limit the amount of alcohol you drink. And of course, it's very important if you smoke, it's very important that you quit smoking. It's not gonna only bring your blood pressure down, but it will lower your chance of having heart attack or stroke. And in the long run, it will help you feel a lot better. Now, I understand that, if you look at these changes, lifestyle changes, it may be overwhelming. It may just sound like a lot of things to do. I think the good news, you don't have to do everything at the same time or at once. The key here is to start low and go slow. So for example, choose one small specific thing to change and try doing it for a while. If it works for you, keep doing it until it becomes a habit. If it doesn't, don't give up. Choose something else to change and see how that goes. Let's say, for example, like you want to improve your diet. If you're the type of person who eats cheeseburgers and French fries all the time, you can't switch to eating just salads from one day to the next. When people try to make changes like that, they fail. Then they feel frustrated and tend to give up So instead of that, to try to change everything about your diet in one day, change one or two small things about your diet, give yourself time to get used to those changes. For example, keep the cheeseburger, but give up the French fries, or eat same things, but cut your portions in half. That may work better. What about weight loss? When people think about losing weight, they sometimes make it more complicated than what it really is. It is hard, but it's not complicated. To lose weight, you have to either eat less or move more. If you do both, that's perfect. That's even better. But there is no single weight loss diet or activity that's better than any other. When it comes to weight loss, the most effective plan is the one that you will stick with it, for sure. So we don't think there is like one single diet that's the best, but in general, there are some tips we can tell you. We know that if you eat a lot of fruits, vegetables, and whole grains, that's good for you. Chickpeas, lentil, peas, that's all we think is a good also. Some nuts, not a lot of nuts, some nuts, walnuts, almonds, peanuts, they're good. Fat-free, low-fat milk or milk products, and some fish. Very important, remember to avoid sugar, sweets, meats, and refined grains. Also, one thing I think important and we have to mention here is a lot of people think that when we say low sodium diet, that means avoiding a salt shaker and not adding salt when cooking. In fact, that's not the truth. The truth is not adding salt at the table or when you cook will only help a little. Almost all of the sodium you eat is in the food you buy at the grocery store or at the restaurant. So the most important thing you can do to cut down on sodium is to eat less processed food. That means that you should avoid most of the foods that are sold in cans, boxes, jars, bags, etc. You should also eat less frequently or less often in a restaurant. So in general, like, to reduce the amount of salt or sodium you get, then what would recommend is, buy fresh or fresh frozen fruits, vegetables, and meats. Then you can make meals at home with all these ingredients. The same thing, like start slow. Don't try to cut out the salt all at once. Choose one or two foods that have a lot of sodium. Try to replace them with the low sodium choices. When you get used to that, low sodium options, find another food or two to change, and then keep doing it until all the foods you eat are sodium free or low in sodium. Become more active. So we talked about diet, we talked about salt intake, sodium. Now we talk about being active. If you want to be more active, you don't have to go to the gym or get all sweaty. It's possible to increase your activity level while doing everyday things that you enjoy. Walking, gardening, dancing are just a few of those examples that you may try. And again, same like other changes, it's not to do too much at once or too fast. If you don't do any activity now, start by walking just a few minutes every other day. Do that for a few weeks. And then if you stick with it, try doing it for longer. If you find that you don't like walking, try a different activity. Then we talk about excessive alcohol. So how much is alcohol is safe? So if you are a woman, do not have more than one standard drink of alcohol a day. If you are a man, do not have more than two. A can or bottle that has 12 ounces of beer, a glass that has 5 ounces of wine, or a shot that has 1.5 ounces of whiskey. So again, the same thing. Start where to start. Start by making the changes that you think is going to be the easiest for you. Whatever you tackle first, just choose specific, realistic goals. It's very important to choose realistic goals. Give yourself a deadline. For example, do not decide that you're going to exercise more. Instead, just decide that you're going to walk for 10 minutes on Monday, Wednesday, Friday, whatever, and then you're going to do this for the next 2 weeks. Most important thing is to take your medicines too. If your doctor or nurse just prescribe the blood pressure medicine, the most important thing that you can do it is to take it. If it causes side effect, for example, do not just stop taking it. Instead, just talk to us, talk to your doctor about what's going on. Either there are a lot of options. We may not have to stop it. We just have to cut the dose in half, for example, or we can switch it to different medicine. If the cost is a problem, let us know. In general, most of the blood pressure medications are not expensive. But if you do have a problem with that, just let us know. We can always choose something else or help with that. I want to just talk a little bit more about salt. What is sodium? I want you to know that sodium is a main ingredient in the table salt. It is found in a lot of food. Your body needs a little bit of sodium to work normally. But unfortunately, most of the people eat more than what they need every day. In general, the average American takes around 3,400 milligrams of sodium each day. But we think most of the people should have no more than 2,300 of milligrams of salt a day. What does reducing the amount of sodium in your diet do to you? Can lower your blood pressure. We talked about it now. And if you lower your blood pressure, and then your risk of having heart attack, stroke, kidney problems is going to go down. It reduces the amount of fluid in your own body, which means that your heart doesn't have to work as hard. It can keep the kidneys from having to work too hard as well. It can reduce the swelling in your ankles, in your belly, which can, be uncomfortable for you. It can lower the chances of having kidney stones, and it can help your bones become stronger. Which foods have the most sodium? In general, processed foods have the most sodium. These foods usually come in cans, as I spoke earlier, boxes, jars, bags. They tend to have a lot of sodium. Even if they don't taste salty, pay attention, even if they don't taste salty, they still can have a lot of sodium in them. In fact, a lot of sweet foods have a lot of sodium in them. And the only way to know how much sodium they have is just to check the label. This is just some examples, canned soup, rice, noodle mixes, sauces, dressings, pre-made frozen meals, deli meats, hot dogs, cheeses, smoked or pickled foods, salted snacks, food, nuts, and of course, restaurant meals. Now, sometimes it's hard to avoid that. So we think, if you really do need to buy canned or packaged food, just look at the label, choose the one that's labeled sodium-free or very low sodium. Choose the food that have less than 400 milligrams of sodium in each serving. So less than 400 milligrams of sodium in each serving. The amount of sodium in each serving appears on the nutrition label usually. That's printed on the packaged food. Can you still go and eat out in a restaurant? Of course. But no matter where you eat, when choosing what to order, ask your server if your meal can be made without salt. Avoid foods that come with sauces or dips. Choose plain grilled meats or fish and steamed vegetables. Ask for oil and vinegar for your salad rather than dressing. And if a meal you really want has more sodium than what you should have, consider saving half of it maybe to eat it another day. And sometimes it can be hard to start low sodium diet, but in general, your taste buds can get used to having less sodium, but you have to give it some time. Try adding some other flavors too. Yeah. But this is so I'm going to stop here, and if anyone has any questions, I'll be happy to answer.